Over the past few days, a lot of news has come out about the AstraZeneca vaccine, Covishield vaccine that all of us took in India, regarding some of its side effects that can cause heart attack, brain stroke, blood clots in the lungs, etc. So let's try and understand what this is all about. So the report says that the Covishield vaccine can cause a syndrome called TTS, which means thrombosis, thrombocytopenic syndrome, which basically means that your body has a tendency to develop blood clots. It can also have low platelets, and these blood clots can happen anywhere in the body. And depending upon where the blood clot happens, you will get that particular organ involved. For example, if it happens in the lungs, which is a fairly common place, you can have shortness of breath. You can have something called a pulmonary embolism. You can have blood clots in the legs causing a DVT or a deep vein thrombosis. The same blood clot can even happen in the brain, causing a brain stroke, etc., etc. So the question is, how often does this happen? Well, it's very, very rare. Many of my patients, many of you have reached out and said, I had this particular pain, I had this particular discomfort. Did I have a vaccine side effect? Did I have a vaccine thrombosis? The chances are unlikely, because we found that it happens maybe in a few patients out of 100,000 vaccinations. So it's very, very rare. And it usually happens within the first few weeks of getting the vaccine. And now it's been almost 2 to 3 years since most of us got a last dose. So the chances of that actually happening to you are very rare.